In the land of Alexandria, Egypt, in the Shatby district, and next to many of the world's famous and historic places, a very vital place to the lives of the children of Egypt is located. This place is the Alexandria Pediatric Surgery Department of Alexandria University. In addition to the residents of Alexandria, the department offers its services to the children living in more than 4 of the biggest governorates in northern Egypt, with a total population of 10 million children. That means any child who lives in the north coast and delta of Egypt and in need of advanced surgical intervention will head to Alexandria Pediatric Surgery Department. 4,500 surgeries are done annually, in addition to more than 30,000 children visiting the outpatient clinics for follow-ups and receiving medical treatment. Unfortunately, and despite that huge burden which increases year after year, the department has suffered a shortage of necessary funds and absence of vision to maintain the minimal accepted standards of service it offers, and it was difficult to accommodate the increasing number of patients. The number of incubators and ventilators hadn't changed since the 70s. In addition to the shortage in manpower, deteriorated infrastructure, and other defects in resources that is reflected on the quality of healthcare offered to all children and the increased morbidity and mortality as a result. 2 years ago, we developed a vision to re-establish, develop, and renovate the Alexandria Pediatric Surgery Department to accommodate the increasing number of patients and to offer the highest standard of healthcare. Over the last 2 years, we were able to accomplish the following great achievements. First, the renovation of ICU. By the end of this stage, we have increased the capacity of the ICU to include 35 incubators instead of just 7, in addition to adding 10 new ventilators to become one of the biggest pediatric intensive care units in Egypt and the Middle East. We also added a new CR X-ray device to perform instant and multiple X-rays necessary for diagnosis and follow-ups. We established a new unit for TPN preparation, which is a very vital corner to do more advanced surgical interventions and improve the recovery outcome. A new laboratory equipped with a new ABG device dedicated to the ICU unit was established too. A big leap was to introduce a new electronic medical record system instead of the old paper one, which was about to decay. Second, operating rooms. We increased the number of ORs to become 6 rooms instead of 3. They were equipped with the latest operating tables, anesthesia devices, and a new and multiple sets of surgical instruments to increase the number of patients operated on per day, and also to decrease the infection rates and the post-surgical morbidity and mortality rates. New endoscopes and instruments for urological surgeries were also added. Recovery rooms were also renovated. Cameras were installed inside the operating rooms to live cast the surgeries to a greater number of junior surgeons for educational purposes. Another important aspect of renovation process includes reconstruction of infrastructure to match the infection control policies. Also, on-call rooms have been renovated to provide more comfort to the medical staff. Third, wards and reception rooms. The total capacity of wards has increased to 22 beds. A new ultrasound device has been added to the emergency room to diagnose and treat many conditions like intussusception. We believe the psychological condition of the child is very important in the treatment plan. That's why we dedicated a library inside the department so kids can enjoy their time. Fourth, outpatient surgery center. Imagine how worried you are when you visit a surgeon. Imagine children and how they feel about it. Saying this, we didn't spare any effort in making sure we decreased the children's anxiety and fear. We added a playroom full of toys and made the walls full of colorful cartoons so they can feel secure and have fun while waiting for their turn. Also, we dedicated a room for breastfeeding where moms can comfortably breastfeed their babies. Fifth, the administration and education sector. 2 new lecture halls and a simulation room have been added inside the Shatby University Hospital. They are dedicated to increase the competence and improve the skills of the doctors, nurses, and medical students. The residence training program has been improved and refined to be up to date, in addition to holding weekly and monthly meetings with pediatrics, pathology, and oncology departments to discuss new cases and multidisciplinary approaches. The department offers training chances to doctors from different countries like Tanzania, Libya, Kenya, and Rwanda, and universities like Oxford. We recently were able to offer the first specialized PhD in pediatric surgery in Egypt, and since our vision includes outreach to surrounding communities in Africa, we have done 2 workshops in Tanzania, which we operated on 60 different children, and established the pediatric surgery department in Zanzibar with the help and funding of Egyptian businessmen. We have taken big steps towards dramatically improving the healthcare quality offered to our children in a very short time, in what is considered one of the biggest renovation and remodeling projects in the healthcare field in Egypt. Our dream became true, and now we can see all patients from different social classes receiving high-quality services and treatment in our department. We hereby thank everyone who took part in making that dream a reality. Our goal is to maintain what we have achieved and become one of the largest pediatric surgery centers in the Middle East. Thank you.